Discover the power of Genome AI's Provider Dashboard. Our cutting-edge electronic records interface streamlines your practice by seamlessly integrating patient visit audio recordings with your electronic medical records through FHIR APIs. This innovative dashboard transforms the way you document patient care. Key benefits include precision record keeping, capture every detail accurately, ensuring nothing is overlooked, effortless documentation, eliminating time-consuming note-taking with automated transcription, and finally, real-time transcription. Instantly convert your conversations into text for efficient, reliable records. Here is a demonstration of this incredible revolutionary tool.
To ensure regulatory compliance and improve the accuracy of our medical notes service, we require your express consent to record and process your voice. This recording will allow us to correctly identify who is speaking during the consultation and generate more accurate transcriptions. Please provide your verbal consent by saying, "I consent to having my voice recorded and processed for medical documentation and regulatory compliance purposes." Start recording.
I consent to having my voice recorded and processed for medical documentation and regulatory compliance purposes.
Please be informed that this conversation is being recorded. For regulatory compliance, we require your spoken consent to proceed. Do you consent to this recording?
Yes, I consent to this recording.
Roberta, thank you for coming in today. I know waiting for these results has been difficult.
It has been the longest week of my life, doctor. Just tell me straight, it is cancer?
Yes, Roberta, the biopsy results confirm that you have colorectal cancer. I know this is frightening news, and I want to take all the time you need today to discuss what this means and what our next steps will be. Colon cancer, especially when we catch it early, is one of the most treatable forms of cancer. Let me explain what we found and where we go from here.
Okay, I'm listening.
The tumor is located in your sigmoid colon. That's the lowest part of your colon, just before the rectum. Based on the colonoscopy and the biopsy, it appears to be what we call adenocarcinoma, which is the most common type of colon cancer. The good news is that the tumor appears to be contained to the colon wall.
So, you don't know if there is a spread?
Colonoscopy gives us good information, but I'm ordering a CT scan of your chest, abdomen, pelvis, as well as some blood work, including a CEA test. That's a tumor marker that helps us monitor colon cancer. The CT scan will show us if there's any involvement in nearby lymph nodes or other organs like the liver. We need the complete picture before we can determine the exact stage and treatment plan.
What happens next? Will I need surgery?
Yes, surgery will likely be the primary treatment for colon cancer in your location. We typically perform what's called a partial colonectomy. We remove the section of colon containing the tumor along with nearby lymph nodes. The good news is that most people do very well after the surgery and can return to normal bowel function.
And after the surgery?
That depends on the staging. If we confirm stage 2 with no risk features, surgery alone will be sufficient, though we'd monitor you closely. If it's stage 3, meaning lymph nodes are involved, I'd recommend chemotherapy after surgery, usually a 6-month course. This significantly improves outcomes and reduces the chance of reoccurrence.
Doctor, I have to ask, what are my chances? I am going to die from this?
Roberta, I understand that fear. Let me be direct with you. If this is stage 2 or 3 colon cancer, your 5-year survival rate is very good, typically 70 to 90%, depending on how the exact stage and how you respond to treatment. Colon cancer is very treatable, especially when we catch it before it spreads distantly.
70 to 90%?
Yes, and those are statistics from the general population. You're relatively young, you're otherwise healthy, and we're catching this at what appears to be an early stage. Those factors work in your favor.
Should I change my diet? Stop working?
Eat a balanced diet, but don't make drastic changes right now. If you're having symptoms like bleeding or changes in bowel habits, avoid foods that aggravate them. As for work, that's your choice until surgery. Many patients continue their routine because it provides normalcy. Listen to your body.
Okay. So I get a CT scan, I find out the stage, then surgery, maybe chemo, one step at a time.
Exactly right. One step at a time. And Roberta, I want you to know you have a good team behind you. I'll be coordinating with colorectal surgeon. And if you need chemotherapy, a medical oncologist will join your care team. We do this together.
Thank you.
Experience the future of medical documentation with real-time transcription, seamless EMR, integration, and effortless record keeping. Genome AI's provider dashboard empowers you to focus on what matters most, your patients. Get started today. Schedule your personal demo and start to streamline your workflow.